Hello, my name is Melina Combs, and I will be discussing HIV and AIDS along with Haley Flemings. HIV is part of a group called retroviruses that contain an enzyme called reverse transcriptase. HIV targets the helper T cells bearing the CD4 antigen, which serves as a receptor letting the virus into the cell. The HIV infection destroys the CD4 T cells directly or indirectly through secondary effects of those cells and the resulting immunosuppression. With progressive invasion of HIV, cellular and humoral immunity decline, and opportunistic infections begin to appear as well. There has been a decreased amount of deaths caused by HIV. However, that does not mean that there are fewer people living with HIV. Because persons infected are living longer, they must deal with numerous comorbidities complicated by underlying HIV disease. This may require frequent healthcare visits. The majority of new nurses will not be working in positions focused on HIV care. However, many nurses will find themselves called upon to care for patients living with HIV. Unfortunately, HIV and AIDS has faded from the headlines, and education for nursing has decreased in nursing schools. And undergraduate students receive minimal education about HIV and AIDS. Consequently, I as a nurse have to take it upon myself to thoroughly assess my patient and make sure that there is no underlying infection, such as HIV, present. The causes for HIV transforming into AIDS is usually caused by the type of HIV, the absence of treatment or the presence of treatment, being in the geriatric population because they're at a higher risk, having an additional infection on top of HIV, poor health practices, or extreme stress and a genetic background. So, risk factors for HIV include sharing IV drug needles or syringes, unprotected sexual intercourse, and multiple sexual partners, history of sexually transmitted disease, mucosal contact with infected blood, body secretions, or fluids, and a maternal IV infection, so that's when it's transferring from the mother to the baby. The complications of AIDS by stage are as follows. The acute stage begins 2 to 4 weeks after being infected, and if any symptoms occur, they are similar to the flu. However, significant amounts of the virus are being produced in the body, and the host is highly contagious, although he or she may be very unaware of the infection because, as I just said, the symptoms may develop and they're flu like. They're not particular to any disease, so they're often asymptomatic in the first stage. In stage 2, the virus continues to reside in the body with no symptoms for up to 10 years, even. However, it can last even longer without treatment. Lastly, stage 3 is the most severe stage with AIDS, and its damage to the immune system is significant as the CD4 count is 200 cells, which is startling compared to the usual range, which is between 500 and 1,500. Survival without treatment on average is 3 years or less. So that is why many colleges, being aware that their students are sexually active or they may be using drugs, they push HIV testing. So, signs and symptoms of HIV include these generalized effects as well: human immunodeficiency virus encephalopathy, which is general brain dysfunction. It is also called AIDS dementia. It refers to the direct infection of brain cells. So, signs and symptoms of AIDS dementia is confusion, progressive cognitive impairment, including memory loss, loss of coordination, imbalance, and depression. Eventually, the person cannot talk or move, and seizures or a coma may develop. Secondary infections in AIDS are often the primary cause of death. There are usually multiple infections, and they are more extensive and severe than usual. Death occurs because drug treatment of secondary infections are often ineffective. So let's say if I got a cold and a person with HIV got a cold, I would survive, but it would be very likely that the person with HIV would not, because um, there are no cures for colds currently, and my immune system is strong enough to combat that. Also, there is an increased incidence of all cancers in persons with AIDS. Diagnostic tests for HIV include a blood test, which tests for HIV antibodies using the HIV antigen. There are 3 stages to this blood test. The first stage tests for the presence of HIV antigen or antibody. The second stage differentiates between HIV-1 and HIV-2 antibodies. The difference between HIV-1 and HIV-2 is that HIV-2 develops more slowly, and HIV-1 and HIV-2 both weaken the immune system. The third stage is a nucleic acid test, confirming the HIV positive and eliminating the false negative. Another test I discovered in my research is called highly active antiretroviral therapy. Such therapy has been going on from the 1900s, and varying results have been seen. Doctors were able to concoct a mix of drugs to halt the replication of HIV in various points of its life cycle. Consequently, within 3 years, there was a 50% drop in AIDS-related deaths in the United States and Europe. This study examined the effects of long-term or 10 years or more of controlled HIV infection. 2 groups were examined: the elderly and the LGBTQ+ community. The 2 groups specifically that were examined were long-term care HIV positive 55-year-old and older seniors and HIV negative gay men in Florida. It was found that the HIV positive seniors had a low count of CD4 T cells and a high number of CD8 T cells. CD8 T cells, also known as cytotoxic T lymphocytes, are vital for immune defense, particularly intracellular pathogens. CD8 T cells distinguish infected cells and lyse those cells harboring the viral infection through the secretion of perforin and Gran enzymes. So, in terms of treatment, antiviral drugs reduce the replication of viruses, but they do not kill the virus and thus are not a cure. Patient comfort is the goal of the treatment. There are side effects to these drugs. Consequently, it is important to make sure these signs are apparent before you start treatment. Also, consider that viruses mutate and they may become resistant. So these are the symptoms that need to be known. Severe symptoms. So again, patient comfort. CD4 count is under 500. Pregnancy, we don't want it to transfer to the baby. HIV related kidney disease, so that means it's spreading. And when one is being treated for hepatitis B. As a nurse, I should note for my assessment and patient interview that alcohol use or alcohol disorders can affect HIV treatment. I researched more into the effects of alcohol and I found a peer reviewed article that discussed comorbid HIV and disorders caused by alcohol use. I discovered that alcohol use disorders occur twice as much in those with HIV versus the general population. Alcohol and drug use in patients is likely to reduce treatment adherence, potentially resulting in accelerated disease progression and neurocognitive impairment. However, there is a domino effect as the development of the neurocognitive impairment may reduce control over behavior, leading patients to further abuse alcohol. Thus, it can be concluded that although the prognosis of people living with HIV has improved, the comorbidities that have also ensued may put a damper on effective treatment. Consequently, diligent clinical management and careful monitoring, proper patient teaching is important for the healthcare team and for me as a nurse, as I am the advocate for my patient. As was previously discussed with the highly active antiretroviral therapy study, there was a significant difference between the LGBTQ plus community and the geriatric group who was HIV positive. They had a higher incidence of comorbidities. So, comorbidities is a huge factor, even though in the past some would say that HIV was more common in young adults who were sexually active. It is also a good idea for patients and just as knowledge to consider comorbidities as an issue. The diet that an HIV patient needs to be encouraged to have is a well balanced diet that includes dark, deeply colored vegetables, brightly colored fruits, and high protein foods and foods that contain vitamin A. Also, I as a nurse should increase their consumption of foods with anti inflammatory properties such as those high in omega 3 fatty acids. I should also encourage my patients to avoid the use of caffeine, dairy products, foods high in fat, and fresh and acidic juices if diarrhea occurs.